Welcome back to Agents Confidential, the podcast for insurance agents who want to grow smarter, serve better, and build a business that lasts.
Yeah, today we're talking about something that separates average from elite agents, and it's diversification.
But not diversification in the way that people usually think about it. Not sell more products, not cross-sell everything.
We're talking about protecting clients more completely.
Yeah, the truth is most clients who have Medicare or ACA coverage still have major financial exposure.
And most agents don't even realize the opportunity that's sitting right in front of them.
Well, let's start with a mindset shift. Most agents think, I sell Medicare, I sell ACA. I help people pick plans.
They think I protect people from financial health risks.
And those are completely different identities because Medicare does not equal full protection for your clients.
Major medical doesn't always equal financial security.
You can have excellent health insurance, but still be financially devastated by a health event.
Right, Yana, and that gap is exactly what diversification actually addresses.
When clients face health issues, the financial risk usually falls onto a few different categories.
Yeah, their income risk, out-of-pocket exposure, serious illness costs, their caregiving can be disrupted, and obviously final expenses.
Medicare and ACA mainly just addresses medical bills.
But it really doesn't stop the ripple effect. Here's something you can say to your clients, like, you didn't spend your whole life saving money just so you could pay your medical bills in retirement. So when we talk about diversification, we're really talking about what happens around the health event, not just the medical claim itself.
This is my favorite part of our conversation because opportunities rarely show up as, hey, I'd really like cancer insurance, please.
Nobody jumps out of bed and goes, I want a hospital indemnity plan like my neighbor.
Yeah,
Right?
exactly.
Yeah, exactly right. Clients don't speak in product language. They speak in life language. And one thing I really want agents to stop saying is, I've got a product for that. I have, this product over here will do this. And really start saying the purpose of this is to X, right? Take care of that issue, that concern.
So these are some things that your clients say every day that are actually signaling that they need some additional protection. I live on Social Security. I don't have much in savings. I can't afford surprises. My spouse depends on me. I'm still working. I had cancer before. My kids help me financially, and I take care of my husband.
And every one of those statements is a protection clue that you need to be listening for. I saw a webinar the other day, and they popped up the word listen. And I don't know if you realize this, but if you reshuffle the words, you can spell the word silent. So as salespeople, we need to kind of remember sometimes to stay silent and listen longer and give your clients some more time to tell you more about them.
And those things are telling you my financial margin is thin, my household depends on stability, and a health event would hurt me.
So let's talk about some questions great agents ask. So instead of pivoting product to product, great agents pivot to understanding the risk. And the best diversification conversations feel like you're caring, not selling. Mm-hmm. So we recommend every agent use some sort of retirement checklist. A form like one of these does a few things. One, it shows the client that you have a process in helping them make a decision. It makes you asking the questions that you're not comfortable with much easier, like how much money do you make? What do you have in savings? What do you have in retirement savings? Because there's a spot on that sheet that the paper's asking to fill that in. And it's just, you're going to the next one, you're going to the next one. And I would say if you get any pushback on these, I would use the jigsaw puzzle example. That when putting a puzzle together, it's much easier when you can see the whole picture or the picture on the box. If they want your professional opinion on what they should do, you really need to see the whole picture. You may not work with them in the whole picture, but in figuring this part out, you need to know kind of what's going on total.
Yeah, here are some other simple questions that you can use. If something unexpected happened health-wise, what would you worry about most financially? And then also, do you feel like your savings could handle a major health event?
And I got to jump in here on this one,
Yeah.
Yana. Some clients may not know or have ever had a major health event,
Mm-hmm.
and they wouldn't know like what the cost is. But I would use some previous examples of clients that you've worked with to saying and put a dollar amount to it, right?
Yeah.
You're doing your intake form, you're starting to get some numbers to say, what would a $6,000 bill do to you financially right now?
Yeah.
How would you pay that? What account are you going to pull this money from and pay this? And
Mm-hmm.
even if you can pull that money out and pay that bill, is that how you really want to spend it?
Some other questions: if you were hospitalized, what expenses would stress you out? Does anyone depend on your income right now?
That's another good one. Sorry,
Uh-huh.
bounce in here.
Yeah.
Um, the income one, most people have a dependency on someone else's income, or if you have a combined household, maybe they're both working. What if one of those incomes just went away? And this really leads into the life insurance discussion. But great sales manager, buddy of mine, gave me a great example, and I'd like to share it.
Mm-hmm.
So we call it the toaster example. Most 99% of households, I think, have a toaster, right? So they can kind of picture this right away and say if the toaster you have popped up $6,000 every month, right? Just on cue, $6,000. How much would you pay to ensure that continued forever, right? Would you pay 5,500 every month to make sure that 6,000 popped up? Probably not. I I wouldn't either, right? But do you think that 500, 800, maybe even $1,000 a month would be a good trade-off to make sure that $6,000 kept popping up? And
I like
that
that analogy.
that really leads into, again, using that intake form where you say, okay, you got 6,000 coming in, you've got 5,000 coming in, so we've got $11,000 coming into this household. Do we want to continue that? For how long do we want to continue that? Right? How healthy are they? Well, at least then you know your payout amount that we would want them to receive, so that could continue for many, many years to come. And it basically gives you your amount, how long, and then you just do the life insurance app.
Yeah, I love
Uh,
that.
good one on the income is the toaster example.
Yeah, I like that. Yeah, and then these last two that I have here is: have you ever looked into coverage that pays cash directly to you? What would you want protected most, income, savings, or your family?
Right, and all those questions, Yana, like none of them are talking about product. Do
Right.
you want life insurance? Would you like a hospital indemnity plan? Let's protect you against cancer, right?
Mhm.
Like it's really focusing on the purpose and protecting them.
Yeah, for sure.
Let's look at some product buckets. Okay, so again, 10,000-foot view. So once risk is identified, there's a few broad question categories agents should at least be aware of.
And this is not about becoming an expert overnight. It is all about recognizing fit.
Right. So at a high level, hospital indemnity helps out of pocket and disruption,
Hmm.
right? That's what it helps with. Cancer, critical illness helps with major diagnosis costs. Disability protects income.
Hmm.
Uh, Life and final expense protects your family. And it can also provide legacy. Dental, vision, hearing, still functional gaps that we want to be looking at.
Yeah, those different clients need different layers to their health insurance. So, and protection. The point is, Medicare or ACA is rarely the whole picture, and you have an opportunity here to help your clients more.
And let's focus on the ethics. Let's consider
Yes,
and
this
position
is
it
important.
ethically.
Diversification can sometimes get framed a little bit wrong. It is not pushing products on people, it is not stacking policies, it is not maximizing your commission.
No, it's really identifying risk, explaining their options, and letting clients choose protection levels that they're most comfortable with.
For sure. And clients are going to feel that difference immediately because the conversation is going to shift from what can I sell to what can hurt you financially.
It was interesting in saying when they're transitioning from, we're talking about a lot of retirement Medicare, they're transitioning from their employer's plan. A great question would be, do you want the same, less, or better coverage that you've had while you were working? And I think most people would say same or better, right? Nobody likes to step down in lifestyle.
Right.
And if your client did say, oh, I don't need as good a coverage as I had, a good follow-up question would be, health-wise, do you think you're going to stay the same, become more healthy, or have more health issues into the future now that you're not working and as you get older? And I think, again, most people would say, well, I hope to stay the same. I'm going to get more healthy in retirement. Well, you're also getting older, right? So the probability of their health going down is high. So we want to, really talk about that in a way that your client's like, yeah, I do need good health care. I do
Yeah.
want to be protected. Agents that grow sustainably almost always diversify.
Yeah. Client depth is going to be more stable than client volume.
Think about it. One fully protected client is worth more long term than multiple partial clients served.
Yeah. Your diversification is going to increase retention, referrals, trust, the lifetime value, and your revenue stability.
And this is better for clients and for your agency.
Yeah, so the biggest takeaway today is identity. If you see yourself as a plan selector, then you're going to stop at Medicare or ACA.
But if you see yourself as a professional that protects and advises their clients, then you'll naturally look for gaps.
Yeah, and clients are going to feel that difference because you're not just helping them enroll, you're helping them feel secure.
So the next time you're with a client, listen differently. Listen for financial vulnerability. Listen for dependence. And listen for like those thin margins where there could be something put in place to help.
The opportunities for diversification are almost never hidden. They're spoken, just not in product language, which is what we're used to.
Yeah, remember that purpose. And the best agents learn to hear them, and it will become more and more natural.
So if this episode helped you think differently about protecting clients, share it with another agent who cares about doing this right.
And as always, we'll see you inside Agents Confidential.
Thanks, everyone. See you next time.